most famous physical therapist on the internet.
Hi, folks. I'm Bob Schupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to talk about, is an anterior pelvic tilt causing your back pain? We're going to show you how to tell, but we're also going to show you how to treat it.
That's right.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. What it is,
We don't
know.
We don't know, huh? You too.
Oh, you're going to keep this the Q2? I thought this
We
was
do
next
know.
week. Oh, this is the Q2.
We're updated.
You got to find it.
There's a little hand massage.
Little hand massage gun.
Gun, yes.
Yeah.
There you go.
So you can also find the contest. It'll be pinned to the top of the page on Facebook. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program.
That's right. And now the podcasts are out and streaming across the whole world. So listen to those. You don't have to look at us.
So my son has an anterior pelvic tilt.
Sure. How old is he?
He is 20. He's going to be 26.
Oh, wow. He's getting older, too.
Yeah, it's my youngest, believe it or not. And anyway, he kind of revealed to me that this past weekend that he's had pain for years doing certain things. It's like, you didn't tell me? I mean, you know.
You what I would have said? You said tough it out.
Yeah, give him a massage gun.
Yeah,
go away.
Go home.
So anyway, I started noticing when I would golf with my son that he had a lot of anterior pelvic tilt, that he really was extended like this.
So we got this pink here. It's not Bob's belt, so you can see it. So
he's supposed to be like this.
Yeah. So we're looking at the bones. We're looking this motion versus into that neutral position.
Right. So if you want to line this up with me, Brad.
Yeah.
If you have a normal spine lined up, a way the therapist will tell is you actually feel for the anterior superior iliac spine.
ASIS, yeah, that's bump.
And the PSIS.
There's a bump there and a bump there.
Yeah. And those should be about level.
Mm-hmm.
And that's what I was checking on my son, and he was like an inch higher in the back than the front.
Yeah.
So you can see he's extended.
Puts a lot of stress on the lumbar spine. Lumbar spine
on
and
the
lower
joints.
Yes.
And that's what he's finding. Like there's someday he can't even lift weights. Because if he stands with the extension, it actually causes increased pain. So what we did with him for the test, very simple test, you can take like a 10-pound weight. He actually took a 30-pound weight, just like this one, Brad.
Well, of course.
And he stood. He's kind of a beefier kid. And I had him stand with the weight close to him like this, holding on to it like this.
Yep.
And you first keep your pelvis kind of aligned correctly. Does that look about level, Brad?
I think so. Yep, looks.
Okay.
Yeah, I could get a level.
Then you can actually flex.
Go the other way. So you tighten your stomach muscles.
Yep. And you're going into flexion.
Yep.
And that was no pain for him. Then he went like this.
Tilted it this way.
And he felt a little bit of pain.
So maybe those facet joints
jamming together.
Coming together. Yeah.
Then we had him actually hold the weight out like this.
Yeah.
And had him go flexion.
Yep.
And extension.
Yep.
This hurt his back. That he felt right away. So
good thing you didn't drop. If you would have dropped that on your toe, you would have felt that too.
Right. So what I would like him to do, and we talked about this already, one, we want to stretch the muscles on the front of the thigh here that are actually could be pulling the pelvis forward. And he is tight there.
Yeah, the rectus femoris actually connects to the ASIS. So if that's tight, that's going to pull down. So we want to loosen that one up in particular.
And rectus, damn near, what was it? Rectum, I damn near killed him or something.
I think you can't apply that to this anatomy.
Right. So the stretch I really like is the couch stretch, and Brad's going to show it against the wall. But I go up to a couch like this, and I actually bring my leg up like this. Oh, I'm getting crap.
Oh, that feels good.
There we go.
You can do it on your bed too, can't you?
Bed.
Yeah.
And you actually lean back like this, and this is a great stretch. I love this way this feels, Brad.
I'm going to take and put a pillow down because it feels better on my knee, my patella digs into there. So this is the same thing.
Yeah, you're actually stretching the foot too.
Yeah.
This one's not stretching the foot as much.
Sure.
But,
so I'm getting a little plantar flexion
Yeah.
right here, which,
Yeah.
nothing wrong with that. Oh, yes.
Really, one I
Oh.
think on a lot of people is tight, and a lot of people if you have a anterior pelvic tilt, it is what's one of the reasons
Yep.
it's pulling you forward. All right, then I want you to start, Matt. I want you to start getting a sense of what it is like to change your pelvic tilt.
Matt's his son.
Yeah. I wonder why I'm yelling at him. Okay, Matt, I need that pillow.
Oh, you don't want to massage it.
Yeah. So we're gonna go ahead and take a throw pillow, and this is gonna make it. I'll show you in a second why take a throw pillow. Take a throw pillow and kind of put it towards the end of your spine, right towards the sacroiliac probably joint.
Yeah, or down by the tailbone.
Top of the tailbone.
Yep.
Yeah.
mhm.
So watch me with this in position. Now it's very simple to do pelvic tilts.
It creates a little gap in here, allows
You see how
freedom.
this is tilting?
Yep.
Now, if I take this out, it's a lot harder to do. I just can't get the travel or motion that
Yep.
you would with
that freedom of movement.
this. It will make it a lot easier. Basically, I'm trying to flatten my back
Yep.
and I'm tightening my stomach, the abdomen while I'm doing it.
So you could do this on your bed or on the floor. Probably better on the floor.
Right,
A carpeted
right.
floor is preferred.
And that'll give you start giving you a sense of where your pelvis is at
Yep.
and how to move it.
Yep.
Now, finally, I want to translate that to functional positions. So we're going to start in the quadruped position first.
Hands and knees.
Yep. So move this out of the way. And Brad, you want to take a look again?
Sure.
So if I go like this, that's making it worse. The anterior pelvic tilt.
Arching the back.
Yeah, so I don't want to do that. I want to go the other way, like I'm doing. I don't know. Have we decided? Is
I think
cat
this
or
is
camel?
the camel. I don't know.
All
The
right.
camel or the
Camel.
cat. Yeah.
So you can start just doing camels. Go to neutral and camel, over and over. So you start getting a feeling what that is like. Then you're going to go up to a surface like this, Brad,
Yes.
and you're going to grab on and to the end of a bed or a couch or
Okay.
a countertop.
So
and you're
ideally, it'd be like this. I
Yep.
know you're trying to show it in
same
the camera.
thing. I'm trying to arch.
Me with my spondy, this is so clear because when I do this, it
You
feels,
know how to do this.
It feels
It fe-
so good.
It feels better.
Oh,
and,
yeah.
and then finally, you're going to stand up and you're going to know how to do this then.
Yep.
You're going to be able to translate it to the real world.
I don't know if this is not part of your script, but one thing that works really well for me is when I hang up against the wall.
Oh, good.
Then my back, I can feel it, and you can arch. Oh, and that feels so
sure.
good. But if I go this way, if you can see what's
I
going
can
on
see
right
it.
here.
Yeah. Move that out of the way, Brad.
There
Yeah.
we go. It's just, and you don't even have to have, you can just do this up against the wall. And it's the same thing as what you're doing laying
Right.
down, but you're in a vertical position.
And it's easier to do.
Yeah, and you don't, you can do this anywhere there's a wall.
So
I mean,
again, you don't need to do this unless you have pain with the anterior pelvic tilt.
right.
Then you would want to do these. And when you're lifting, you want to go ahead and do the pelvic tilt
Yep.
back and put your back in the correct position so you can lift without putting stress on the facets.
Which, by the way, if you happen to have stenosis, lumbar stenosis, or somebody that does similar exercises,
While spondy. too.
exactly, spondylolisthesis.
Yep.
So, yeah, I don't mind just doing this while you talk. It feels
Sure.
so good. Go on.
I hope you're happy. Well, by the way, Brad and I can fix just about anything.
Except for,
A broken heart.
and we're not getting too far on it, but we continue to persevere.
Darn, we got to make some advancements on that,
I
Brad.
know what I'm thinking about it.
Think we
Last
massage
night I
it?
thought about it for about
You did not.
before I went to sleep, 2 seconds.
All right. Thanks for
careful.
watching.